growing up and watching my mom as well as my grandmother in the healthcare field, you learn the dedication it takes to do this job and the work that comes with it, but again, also the joy that comes on the backside of that.
Misty was 4 when I graduated, or 5 when I graduated, 4 when I went to school, and I grew up sitting in the chair here in my office, and now it's the other way around. I come in and sit in her chair. It's a family tradition. My mother was a nurse. I became a nurse because of my mother. My daughter became a nurse first because of my mother and me. And she has a daughter now who is going into nurses training, another one in physical therapy, as another one as a PTA assist. So healthcare, from a variety of different advantages, is in the family.
You really grow up and you learn that working in a small community in rural South Dakota, and specifically your hometown, that is really more of a privilege than just a job. When you get to come home and take care of the people that helped raise you, you start to see the generational impact of, now I'm not just taking care of, the adult group, it's the grandparents, it's the parents, it's the kids and the next generations to come. And as you see that come forward and you're still taking care of those families, it's pretty special.
Yeah, I've had adults come in and they're bringing their children or their grandchildren, and I look at them and say, I took care of your grandmother when she was little. And it's like they look at me like, really?
Being able to positively impact those same people that gave me the start, that put me where I am today. Those people, some of my teachers, they're still here. And I look at them and go, they started me on my path, along with the passion that my mom had and my family members have had in the healthcare field. Knowing that in the care that I'm providing out to the community, it's coming back to me 10 times over. Those same individuals are helping care for my kids, my family. In the events we do, they're cheering my family on just as much as I'm cheering theirs on. We sit in the ball stands together, we go to church together, we do all those things together.
South Dakota is rural, and we don't have the advantages of a lot of the metropolitan areas and the larger cities. We don't have multi-physician clinics. What we have are sites with mid-levels who are delivering care on a day-to-day basis, bringing medical advantage to a lot of people who otherwise wouldn't have it.
I believe everybody deserves the best, highest quality of care where they live. It shouldn't be a negative because I want to live in rural South Dakota versus somebody who's living in Sioux Falls or the bigger cities. That is not what this is about. You should be able to live and raise your family where you want to be and still get that level of care.
Having the ability to hear the story, put the pieces together, make a diagnosis and a plan of care, and actually help people has been the greatest life accomplishment as far as I'm concerned. And it just gives me satisfaction that maybe I made a difference sometime along the way.
This is why I was meant to be here.